We've got, thank you, Jamie, for doing the recording. I'm going to share my screen. All right, can you all see my presentation?
Yes.
Cool. I'm gonna do my best to follow the chat. You can definitely feel free to raise your hand using the Zoom function if you have questions, and I'll try and pause to answer them. We have a good amount of time today, so I'm gonna try and go through this slow. But also I don't think we certainly won't need the whole 2 hours for my presentation. I'm happy to stick around sort of for as long as people have questions or want to talk. Um, so yeah, it's amazing to see so many people come out. I really, really appreciate so many people making this time. Um, I do always like to sort of open these webinars with a grounding that today we're here talking about insurance, and primarily we're talking about dental insurance and vision insurance. And I do want to hold just this value that I hold very deeply personally, and I know that we hold as a federation of worker cooperatives, that healthcare is a human right. And right now in this country, it's not treated as such. But we want to use our power as a membership organization, and as an organization that has workers at its core, to just acknowledge what we all deserve, and that we set up this program so that we can try and figure out how to navigate it better together, um, and to lessen the impact of healthcare costs and use the power that we have as this many hundreds of member organization to make it a little bit easier. So that's why I love doing this work and why I love working with all of you. So thanks for being here. Today we're going to discuss the worker benefits program. I'm going to do sort of a high level overview of all the things we offer. Um, but then we're going to go zoom in and focus really on the dental and vision benefits for 2025. Um, We'll also talk about preparing for the open enrollment process and discuss the current offerings. We're going to have some time for also just questions and general discussion, because this is such a rich opportunity for all of you who are doing and participating in this benefits program to be together to talk about sort of what works and what are other ways we can be supporting you all as a federation, and even to find out what else you all are offering to your workers outside of this program that people might be able to get ideas from. Um, so yeah, we have this is sort of the overview of our offerings. Sort of our core program is the dental and vision insurance offerings, which we're able to offer as a group plan across the entire federation, for all our members to have access to the same plan and the same prices, um, which really creates some opportunity for improved benefits and improved pricing that is very difficult to access for small worker cooperatives otherwise. We also have this incredible new partnership with Just Futures Retirement to offer discounted rates to their services, for our members. So you get to benefit from the expertise that they've been cultivating over at Just Futures, the decades of experience working in finance, working in retirement benefits. Um, to do that work in a really wonderful way that is, in a lot of ways, values aligned with, the progressive and solidarity economy organizing that we all do. We also have offerings to support people with access to accident and disability insurance, tax advantage reimbursement plans, which you might have heard of as an HSA or an FSA or an HRA. And we also have resources to support with health insurance. One thing I do think that isn't really captured here that I do also want to mention is that I also love to work with all of you just in sort of troubleshooting and thinking through what your health benefits for your organization can look like. So I do just want to make sure that you all know of me as a resource to um, sort of think strategically about like a long-term plan for your organization or your workplace, your co-op's um, health benefits offerings. Um, so as I said, like sort of these are our fundamental pieces of the worker benefits program. The programs that we offer are open to any USFWC member organization that meets the qualifications of the plan. So the only restrictions you're going to run into are ones that are either imposed and non-negotiable by the insurance companies or by like federal regulations or state regulations. We want to create a program that is as low barrier as possible for our members. In addition to sort of follow with that, our plans are open to people who have social security numbers or individual tax identification numbers. Um, Immigration documentation status is not a factor as long as someone has either a social or an ITIN that they can use. We're also always striving to be inclusive of LGBTQIA folks. Um, we don't care what your partner's gender is. We don't care if you gave birth to your kid or if someone else did. Like, we're really trying to make this as flexible for all family types as we possibly can. And also as trans inclusive as we can. I'm always sort of looking for different ways to build out systems so that people who use a different name than their legal name can um, avoid interacting with their legal name, especially if it's a dead name. Um, and also always just like really interested in feedback or ideas about how we can like make our program even more expansive. Um, I know somebody I've been talking with for several years about like figuring out how we can get more um, like partner configurations where people have more than one partner into their plan. We haven't made headway on that, but it's something. Thanks, Jamie. Okay. And yeah, the other piece that is fundamental to our program is that we are not an insurance broker. I'm not an insurance broker. We work with partner insurance brokers to get access to these plans. But at the end of the day, it's not my job to sell you insurance. It's my job to support our members in navigating the health system. So if there's ever like a question of like, I don't know if this program is the best fit for us or not, I'm going to work with you to figure out if it's the best fit for you or not. I'm not going to be like trying to push you in one direction or another. And that's something that is really important to my values personally. Um, that like we're working for our members. We're not working for the insurance companies. Another important note is that we have these really great dental and vision plans that are available to all of our members. We cannot offer something similar for medical insurance at this time because it is so complex from a regulatory perspective. There are so many rules from both the federal government and the state government um, that make it basically impossible to create like a pooled plan or an association plan that all of our members can join at the same rates. Um, we can offer a lot of support with helping figure out what is feasible for your co-op, where you are in your industry for your workers. Um, and I love doing that kind of work with our members. As Colin said, I've got to work a lot with him and some other people to try and figure out sort of what the best options are on the table. Um, yes. So just one note that I also want to put ahead of this is that like usually in these presentations I'd be able to offer you like these are the rates for 2025. This is every step you need to get enrolled. Because of some improvements we're making to the program for 2025 and also just the insurance companies being the insurance companies and being somewhat slow, I don't have every piece of information for you today. But what that does mean is I can give you at least preliminary information. And we'll be following up for everybody who registered for this webinar, as well as everyone I've been talking with, whether you're renewing your benefits or are trying to figure out if our benefits are the right way to go. I'll be following up with videos, with emails, with instructions, and we'll also have another office hours in November to go over more of the details once we have that. And we hope to have more of those details in like hopefully in the next week, if not by November. So appreciate your patience with all of that. Yeah. So we're gonna dive into dental and vision insurance. Um, as I've been saying, it's this program, it's open to all of our members. We currently have over 60 organizations in our membership enrolled, with over 600 people currently enrolled. And I think over the life of the program, we've served well over 1,000 people with our dental and vision insurance plans. It's available in every state. So if you're the first co-op joining our membership in a state that we didn't currently have members in, we will be able to offer you these benefits. Um, and the other piece that's really key about it is that the Federation bills our members directly for your organization's portion of the bill. So instead of having a bill due to an insurance company each month, we pay that bill for everybody, and you pay the Federation for that chunk that your workplace is responsible for each month. And that's really important because it means that we're able to offer flexibility with with billing if your company is encountering a hard cash flow moment or just like a admin person transition moment and you're trying to get like the work systems uh, trained over, like we're able to offer our members more flexibility than the insurance companies do typically, with late payments when you need to make them. Um, as I said, organization eligibility, any membership type across our membership can be part of this. So if you're an associate member, um, you're welcome to join. We do ask that associate members pay $500 in dues in order to get access to the program, just as sort of a solidarity and contribution to the work that goes into this plan and the programming that we do for worker co-ops. And we're happy to talk more about that with anybody who that applies to. But for all other membership types, for worker co-ops, democratic workplaces, developers, um, local networks, uh, no matter what the dues are, you're eligible to participate if you have eligible workers. We do require that workplaces pay a minimum 50% of the premium, which is the monthly cost for each worker. Um, you're not required to contribute to the dependent premiums if people want to enroll a child or a partner. But we do encourage that the workplaces who are part of the program pay for all of or as much of the premium as they can, because it's ultimately um, good for the longevity of your benefits and good for just good employment practice. Um, for dental insurance, there is a rule that 70% of the qualifying workers who don't already have access to a plan have to enroll. And there's no percentage requirement for enrollment for vision. So if you have a workplace of 11 workers, one person has it through a spouse's plan, um, then you need to have 7 people enroll for dental. But if only 2 people wanted to enroll in vision, that would be fine. And then for individual eligibility, workers have to be either on payroll or be owners of a business and having their income reported on a K-1 form. So 1099 contractors cannot be part of the plan. Um, and that's a very clear and very strict rule from the IRS. So we unfortunately can't have flexibility there, but we can offer, anybody who's being paid as an owner on a K-1 or as a W-2 employee can participate. Workers are expected to work an average of 20 hours a week or more for eligibility. And workers must have either an individual taxpayer identification number or ITIN or a social security number. The dependent coverage is available until the dependent turns 26. So if you have a kid who's in college or is just out of college or just starting their working life and doesn't have a health plan yet through their employer or through another means, you can have that kid on um, the healthcare plan, the dental or the vision plan until they turn 26, like you can with any health plan. Um, being inclusive of LGBTQ folks, our plans are open to two-person domestic partnerships of all genders. We don't have any requirements of things that you have to provide to like establish that you're partners. It's possible that an insurance company would ask you to like submit something that shows proof of like living together or shared finances if there was a big claim, but I've never seen that happen in my 5 years of doing this work. Um, and then, as I said, we also have systems in place to minimize contact with legal names or with dead names to the extent that it's possible. Um, Legal names do have to be submitted to the insurance companies, but um, we try to sort of override those in the databases that go back to workplaces and to um, to the people who are enrolled themselves. Okay, so now let's talk about rates. Like I said, these are preliminary rates for 2025. Right now we're looking at vision staying the same, though I think it's possible we may get rates back that go up a little bit. The dental rates you'll see here are quite an increase from 2024. Um, we're working on negotiating them down, but we're not sure that that's going to be possible. Um, there are several reasons for this, and I think that sort of the clearest one is that we were essentially given a big discount for the past 2 years by Delta Dental, and now they're adjusting us back to where we were before in 2022. So in 2022, the premium was $36 per person. We went down to about 29, which is amazing for a couple of years. But now we're sort of back at this almost 36. So it's still a little bit less than it was before, but not very much. We are still seeing this as like pretty competitive for the benefits that we offer, which are quite strong. Having the um, $1,500 or annual um, maximum, and then also having the equivalent out of network coverage for the to in-network benefits. So it's an increase. It's not ideal, but it is sort of what it costs for the benefits that we currently have. We've even looked at rates from other insurance companies and have gotten either equivalent or higher rates. Um, Something that we will do probably next year is um, do a survey of all the folks who are enrolled, all of you, all the members, to see sort of are these rates okay, or are there other places in the program where we want to negotiate to try and get those rates down? Um, so yeah, that's kind of where we're at with that. Um, the per organization per month rates have gone up like very slightly, $1 to $2 a month. And these rates on the bottom are just per organization per month. They are not per person, they're just per organization. Um, Sarah, I'm seeing your question of having one person that only works 10 hours a week. So they would not be eligible to enroll in dental because the 20-hour sort of minimum vision she could enroll in. I do want to see if anyone has questions about the rates. The organization rate is in addition to the per person rate. It's sort of, we call it an administrative fee for the services that you all get through the program. So if you have 10 people who are only workers enrolled, you'd be paying 375 or $357.90 a month for all of the workers' premiums, plus that $31 per month for dental only. And this is not the only time you're going to see this. We'll be distributing rate sheets with the recordings for this. I'm going to try and hold to see if we're going to get any changes with the rates. But I think we'll know in the next couple of days if that's going to happen. Okay. Before I go into sort of the explanation of what the benefits themselves look like, I do want to just go through this insurance vocabulary key terms just so everyone is coming to this with the same information. So I was talking about the premiums. The premiums are the monthly cost of an insurance policy, whether you use it or not. So these rates in the dental and the vision column, those are the monthly premiums for each person. Just the worker on their own, if they want to add a partner, if they want to add children, or if they want to have a partner and a child added. A deductible is the amount that you pay for healthcare before the insurance pays anything. For the dental insurance, it's about $50 a person. Co-pays or co-insurance, this is what you pay when you go to the doctor, and you are basically sharing the cost of your coverage of the visit with the insurance companies. A copay is going to be a flat amount that will be outlined in the insurance policy. The co-insurance is a percentage of the cost of what the doctor will bill the insurance company. With dental insurance, we're working with dental maximums, and that's the amount the insurance company will not pay more than during a year. So with our plan, it's $1,500 a year. So if you have a dental expense that costs more than $1,500, the insurance company isn't going to pay more than that. Okay, so the plans themselves are the same as what we're offering right now. The real highlights of the coverage are that if you're on this dental plan, you are entitled to 2 routine exams and cleanings per year, free of charge, no additional charge, no copays, no co-insurance. Pregnant people get access to an additional cleaning each year, which is great. That's really important during pregnancy. You're entitled to a set of x-rays each year for no cost. That's when they give you the lead smock and stick a card in your mouth and take an x-ray. And then for children ages 13 or under, they get 1 fluoride application each year to help their teeth be strong. For more complicated procedures, for your crowns, for fillings, endodontics, things like that, the plan will cover either 80% of that cost or 50% of that cost up to that $1,500 max. And the flyers that we'll send out will have more details about what's covered at 80% or what's covered at 50%. For the network, Delta has 2 main networks, which is PPO and Premier. Our plan covers both of those networks at the same rates, in addition to out-of-network dentists at the same rate. The only difference with the out-of-network coverage is that you will probably have to pay the cost of your procedure up front, and then either you or the dentist would submit a claim to the insurance company, and then you'd get a check back for the amount that you paid. That actually just happened for me. I had to pay out of pocket at my dentist, and I got a check from Delta in the mail. For vision, we are going to continue with the same offerings of the option of either VSP Vision or iMed Vision through Emeritus. Um, the reason why we offer these are two different networks, VSP and iMed. Most eye doctors will take one or the other. Those some do take both. Both are national networks, but some are stronger in one location than another. So we are offering these two because we know that they're gonna together cover the needs of all of our members who are enrolled. It's really up to the workplace if they want to offer their workers the choice of one benefit or another, or if they want to decide, no, everybody here is going to be enrolled on iMed because we just don't have VSP doctors in our area, or vice versa. For each network, the benefits are basically equivalent. Um, there's an annual exam covered at a $10 copay. That's when you go and they do all the normal eye exams. If they need to do dilation, that's included. And then both of these networks offer essentially an allowance for either your glasses or your contacts annually. Um, so they'll give you an allowance towards your lenses and cover a pretty significant amount of the cost of lenses, and then also an allowance for frames. Um, it's definitely possible that you could find cheaper glasses available at one of the like online vendors that you could then submit an out-of-network claim for to get some of the costs back. Um, but we have some instructions about that that will get distributed, and it's really up to you. This plan does not have as strong out-of-network coverage, but there is some. Yeah, and so like I was saying, there's um, the really main difference between VSP and IMED are the networks themselves. Um, Networks of doctors change a lot. So if you're trying to decide or you're helping a worker at your organization trying to decide, a great thing to do is just call your preferred eye doctor. Say, hey, I have the option of VSP or IMED, which is better. They'll tell you which one they're covered by. Um, or to use their like online search engines, both VSP and iMed have a like find a dentist, find or not find a dentist. You can't find a dentist there. Find an eye doctor who is in a 10-mile radius of me, and they'll send you a long list. Okay, are there any questions at this point before we go into some of the like more moving pieces of how this all works day to day? Okay. So a really important piece of this program is that the organization, you as a member, um, are getting a lot of information from me and from May and from our team about these programs and about the way that it all works. And it really is important that each member that is enrolled has a point person that interfaces with me about or to communicate information about the plan back to the workers. And I think most people on this call hold that role in their organization, or maybe they will, or are trying to decide who in our organization will hold that. So this is what these slides are really about, like how you and I work together, and sort of what your responsibilities are, what my responsibilities are. Um, so organization responsibilities or member responsibilities. It's the member's responsibility to inform the workers who are at your organization of their eligibility for dental or vision insurance. We will send you a lot of information. We try to provide both like really simple sheets with information about the plans and also the more detailed information that people can use if they need to or want to learn more. It's your responsibility to share that with the eligible workers. There's also going to be a roster, like a list of everybody who's currently enrolled in your organization. If you're already enrolled, we will send you a list for you to check over and see if there's any changes to be made. If you're brand new to the program, we'll send you a blank one for you to fill in. And it's the member's responsibility to make sure that that is accurate and updated, and that you keep me informed of if there are changes. Is somebody leaving? Is somebody coming? Do we need to add someone new because they just increased their hours and now they're eligible? Or somebody's leaving the plan because they got married and they're going to go on their spouse's plan. Those are the kinds of changes that I need to be informed about in order to make those changes go through and to keep people's insurance active and to make sure that we're billing you all correctly. Uh, yeah, and so after open enrollment, continuing to inform new workers of their eligibility for these plans, and supporting members who need troubleshooting, whether that's a matter of like getting a claim filled that something isn't working with it, or if they can't find a dentist and they need help with that. Um, we can do lots of things. We can send you um, lists of all the dentists or eye doctors in your area. We can connect you with the brokers who can advocate around claims. Um, but we, of course, need to get that connection to the workers in order to provide that support. So we're always here and available. Um, these kinds of support requests from our enrolled members are like our first priority when we get them. So, please talk to us, ask us questions. We are here for you. The other really important thing is that these are plans where people are eligible for COBRA, which is a program that allows people to continue benefits they got through their workplace after they leave a workplace by paying for them themselves out of pocket. Um, so yeah, that's something that you get instructions about, um, and that we provide some information with how to communicate about that. So it's our responsibility. There I am in this little illustration, um, at my desk with my plant. It's our responsibility to make information available to you all about the available plans and the changes from previous years. So I'm doing that right now, and I have a lot of responsibility to keep you all informed about these new changes and the sort of like finalizing information over the next several weeks. Um, it's my responsibility to answer questions, and if I don't have the answer to the questions, refer you to a broker or to someone else who will know, or to go find out myself. It's my responsibility to distribute the forms to you all so you can distribute them to your workers, to your members. And it's my responsibility to communicate about information that we don't have, that we need in order to get the plans activated. So if someone submits um, an enrollment form with a birth date that's clearly wrong, say their birthday is October 15th, 1994, but they accidentally said October 15th, 2024. Obviously, that's wrong. So we need to find out, like, okay, what's the actual thing? But we need to tell you when those errors come up in our system so we can get the correct information. After open enrollment time and throughout the year, It's our responsibility on the Federation's team to be processing changes to enrollment in a timely manner, uh, to be distributing the billing invoices monthly. Those come out on the 4th of each month, and we try very hard to make sure they come out on that day so you can expect them. Um, it's our responsibility to respond to your requests for insurance cards, claim issues, other plan information. You need a link to a form um, to respond in a timely manner, and to answer other questions and troubleshoot as needed, and to refer and bring in our broker team when it's necessary. So for billing, like I said at the start, our billing process is um, it's a really important part of our program, um, because one of the most challenging things for and one of the reasons why it's so hard for small groups to get access to good rates is because it costs the insurance companies money to be managing lots of different small groups. So we're essentially like taking a big part of the work off of the insurance company by all working together to do the billing, to do the administration. So Delta Dental and Ameritas send the Federation a bill every month for the cost of everybody's enrollment. Um, so every person who's enrolled on the plan, we get a bill for that entire amount. And then it's our responsibility to pay that bill on time every month. Um, we then split that bill out based on who from each organization is enrolled. And we send those bills on the 4th of each month through QuickBooks to each enrolled member. And then it's your responsibility as the member to pay that bill every month. Um, you can set up automatic payments. QuickBooks has been really annoying with that because they made it look like people could set up auto pay, but it got really buggy. So we try to do that manually now through forms that we'll send to you if you want them. Um, but either an invoice or an auto pay gets processed every month and goes out to you all. It's due within 2 weeks. We have another 2 week grace period. Um, and beyond that, like we do a lot of work to stay in communication about outstanding payments and doing anything we can to not have to like end someone's coverage unless we've communicated with them that they don't want it anymore. Okay. Before we get into organization prep, are there any questions about the billing process or sort of how things work throughout the year? I'm getting reminders from my colleagues to drink water, so I'm gonna take another sip. Okay. So, in order to prepare for open enrollment for 2025, which is where we are right now, there's a lot of things that can start to happen now. There's a lot of information that's going to be coming out in the next few weeks. But even before then, there are things that you can do to start laying the groundwork so that once that information comes, you're ready to get started. Uh, so in the follow-up to this webinar, and also via email to everybody who I know is either currently enrolled or interested, you're going to be receiving informational sheets about the plans. And I would suggest that if you are the like point person for a member organization who's trying to enroll or renew, to either schedule a meeting or however it is that you typically communicate with your colleagues about things they need to know about to plan to do that. and to plan to do that in the next few weeks. Maybe the beginning of November is a great time to do that before we like are suddenly in the pre-Thanksgiving time when I know it gets really hectic for people both with taking time off or if you're um, in the service industry doing things, preparing for the holidays, etc. I would suggest getting started with that so that you can be distributing information in early November and making sure people are filling out the forms they need to fill out. Um, if you are still in the process of figuring out, like, are we going to do this? Are we not going to do this? And you get to a point where you feel like you made a decision, please let us know as soon as you can so that we can help you get set up either with, yeah, with the process of enrollment, with the process of renewal. Uh, so yeah, determining, oh wait, a question from Kara. Is it ever possible to enroll at another time if you have current insurance and want to wait till that ends, or if a new employee joins mid-year? Yes, if you have a qualifying life event, you can change your enrollment mid-year. So a qualifying life event would be like someone starts their job. Um, they can enroll mid-year. If you lose insurance because it's no longer active, um, whether like you were on a partner's plan that like had a mid-year enrollment restart date or something like that, you can enroll mid-year. Um, there's a if you Google qualifying life event, you'll find a list like on healthcare.gov of all the reasons why you can change coverage mid-year. And if you ever have a question about that, I'm happy to help sort of figure out if it's a qualifying event. So for open enrollment, now is a great time to start figuring out like who's going to be enrolled, who's eligible, and who wants the benefit. Um, Keeping in mind that 70% threshold for workers who don't have coverage elsewhere. So if someone has coverage through a parent, through a spouse, they are not, they don't have to be considered in that 70%. And there's no minimum provision. Like I said before, the eligibility requirements, workers have to be on payroll or be owners of the business and paid on K1s. Workers have to work an average of 20 plus hours a week, must have an ITIN or social, and dependents can be enrolled until age 26. Um, right now is also a great time to start preparing your roster for 2025. If you're currently enrolled, you can review your current roster. Um, you can make notes of any changes to current enrollees information and make note of new people who need to be added. Um, Later in the next few weeks, you'll be getting a form for each new enrollee to fill out or each person with a change to fill out. Either the worker can fill them out themselves or a point person can fill them out on their behalf. Uh, I'll definitely be sending out instructions and like instructional videos on how to go through those forms. If you're looking for your roster because you're currently enrolled, here is a sample. You'll have received an invoice email on the 4th of this month or a sales receipt that has information about your invoice. And at the bottom of that invoice, there is both an invoice document attached as a PDF and also a roster of everybody at your organization who is currently enrolled. And that's a CSV file, so you can drop it into any sort of spreadsheet, whether it's Google Sheets, Excel, Pages, whatever. Um, Yeah, so right now the deadline for open enrollment to end is November 22nd, but the actual effective date is January 1st. Um, November 22nd is definitely like it would be great if things were done by this point, but we will have a good amount of flexibility into December to finalize things, um, and make sure everybody is set up. So, uh, yeah, secret, not so secret for people on this call is that it will be extended. But we are hoping to get the bulk of people at least naming their interest by November 22nd so that we can have a smooth enrollment process. And so, yes, benefits begin January 1st. You can be this happy beaver with a toothbrush or this happy owl with heart-shaped glasses. They're effective immediately on January 1st. So if you have a dentist who's open on January 1st, you can go see them on January 1st. Um, the insurance companies do not send paper cards anymore. It's like, I'm told it's not so much of a thing for dental and vision to send cards in the mail anymore. It should be sufficient for the dentist or the eye doctor to get a person's social or ITIN and the insurance company name. Um, they can look them up. They should be able to look them up in like whatever system they have. Um, that said, there are also instructions for how to get digital cards. And I can also send out digital cards to anyone who requests one. There's also a document called a plan document, which includes instructions about how the benefits work and what people's rights are with the benefits that are required to be distributed to enrolled members. And I'll send out those documents along with an email template in both English and in Spanish that you can send along to everybody who's enrolled. Try to make that as easy as possible because it is a requirement. Okay, I'm gonna take a break for questions on dental and vision, and then I'm gonna talk a little bit about the retirement offerings because I know people are interested. And then I will take other questions and we can talk a little bit more. For the disability and accident and for health insurance stuff, if you're interested, you should email me and we can talk. Either you can have a one-on-one meeting or I can send you materials. Um, and I know I just went through a lot of information, so take a moment. I'll drink some water. Um, Let me know what questions you might have, or if you even need just like clarification on something that I went over. All right. Are people ready to learn a little bit about our retirement plan partnership? All right. I'm getting a thumbs up from Kara. Thank you. Okay, cool. So this partnership with Just Futures is really exciting. We've been hearing for years from our members that they need a retirement option um, for their workers. And we know how important retirement options are in um, just like providing a good workplace, providing necessary benefits that a lot of companies offer. In some states, there are new requirements around offering retirement plans because it really is key for us all to be able to retire, to live into our old age and enjoy our families, to rest, to not have to work anymore. That's really important. And it's taken a while for us to figure out sort of what is the best way for us as a federation to provide our members with these offerings. Just taking into consideration how important it is to be done right. It retirement involves people's life savings, and that is not something to be taken lightly. And it's something that we take really seriously and the responsibility really seriously. So we decided that the best way to do that would be to actually partner with an organization, a company that that's all they do is retirement benefits, because we know they have the expertise that they need, and are doing all the things that are necessary to have like a reliable, safe plan, that that's not my area of expertise at all, nor is it anybody else's on staff. So when we learned about Just Futures and how they approach retirement savings, um, and also they have this ownership structure where it's partially owned by movement organizations. It seemed like a really natural partner for us, and they have given us some really amazing discounts for our members. So there's a long presentation from Just Futures, and they did an amazing webinar for our members earlier this year that I'll make sure the recordings in English and in Spanish are linked in the follow-up to this webinar. But we'll go through a couple slides today just to give sort of a sense of their program and what they're offering Federation members. So Just Futures, they're acting as an investment advisor that are giving like a turnkey solution for employers for retirement. Turnkey meaning like it's ready to go. Like you have to go through a process of setting it up, but you're doing something that's already been designed, already been set up. They have a lot of training materials and just a ton of knowledge about how retirement investing works, which I know is like pretty mysterious to me. And yeah, I'm just really happy we have like people's decades of experience with finance, with um, retirement funding, with investing, with all that in Just Futures. And then they're working directly with Vestwell, which is basically like the platform where you get to see like these are my investments. This is how it's like here's the trajectory for its growth. Um, and here's like how much I'm putting in each month. Here's how much my employer is putting in each month. And they also do all the like record keeping and compliance, which is really, really important, because there are a lot of rules and laws guiding retirement savings and accounts to protect people's money. Um, so these are some of the services that Just Futures is offering. They support you to figure out what plan design is right, whether it's just like the automatic one that they have as sort of the default or something a little bit more specific. They go through the onboarding process. They offer a lot of information. Um, they support the implementation, like integration with whatever payroll processor you use, um, and also introducing workers to the Vestwell system. And then over time, once it's all set up, they're available to offer support, to continue doing trainings. Something that I think is really important about what Just Futures offers is that they have a really detailed and deep analysis of how the way that a workplace sets up this benefit um, can help can help reduce the gender wealth gap and also the racial wealth gap, which in this country we know is so enormous. And they just have put a lot of thought into um, how to set up a plan, like even down to like do a percentage or a flat amount, and like what are the pros and cons of all of those things, and like what's a place where you can begin and what's a place you want to have as a goal to get to. And so I think their team is really great at explaining that stuff and laying out different options. Uh, oh, no, I wanted one moment. I'm gonna pull up. I wanted to show the discounts, but I think I took the wrong slides. I'm going to, I'm gonna just pull up this other slide deck very quickly. Okay. So this is a lot of information on one slide, but it is showing the discounts that Just Futures is offering to our members. So with Just Futures and with most retirement plans, there's a setup cost as well as an ongoing monthly cost. And so for US Federation members, um, you're getting a $250 discount on those startup fees. So for the more basic plan, that's actually just a waived startup fee entirely. For the more complex plan, it's down to $750 from $1,000. Uh, and then the other place where our members are getting a discount is with this asset-based fee, which are the fees that go to Just Futures. So for businesses that are in our membership, you're getting a 32% discount off of their 0.7% asset business pricing. For nonprofits, it's a smaller discount, but you're starting from a much lower um, starting point. So it's a 5% discount off of a 0.3% nonprofit pricing. Um, yeah, so that's it's a very brief overview of the Just Futures partnership and how it's benefiting members. And I would really encourage you, if this is of interest, to go and look at the other webinars and resources that we've made and also talking to their team directly. Um, yeah, so it's a really exciting new part of our program to be having this partnership. I'm also really interested to hear from folks like, if you do work with Just Futures, what's your experience like? Um, what are their strengths? What are their areas for growth? These are things that are really important to me as well. Okay. Any questions about that? Okay. Sorry, I'm just fixing something. What I noticed was wrong. Okay. There are, we're getting sort of to the end. Okay. What type of retirement and plan it is? Sorry, Nolan. I'm trying to read and type at the same time. Okay, Nolan asks what type of retirement plan it is. So it's either a 401k for companies or they also have a 403b product for nonprofits. They don't offer a simple IRA at this time, though they did just start rolling out an individual IRA that people can join individually, but it's not a group thing. Um, the asset-based fee is um, I don't because I'm kind of like lost when it comes to the world of retirement savings and finance. I definitely can't give you a good explanation of what an asset-based fee is. Um, and I would encourage you to ask them some more about it. It's like it's a percentage of either the like earnings of the retirement fund or the whole thing, but I'm not sure. Um, so you should ask them. It's a great question for Just Futures. This is why we said someone else should have this as their area of expertise. Um, cool. But it's a good question, Henny. All right. Okay, so before we close out, I do want to share just like some key information key links. Um, oh, I'm seeing more questions. Retirement plan can be opted into at any time in the year. There's not an open enrollment period for that. So you can like start learning and then when you're ready, you can get started. It's not attached to an open enrollment time. Are there requirements to apply for retirement? There are there's a lot of different ways retirement plans can be configured. So the likelihood is that like sort of no matter what your co-op looks like, they can help you figure out how retirement savings can work best for you. Um, yeah, we're definitely going to share the slides. There's like a lot more of the Just Futures presentation that I will also make sure you get the slides and the whole presentation. Yeah, so some of these key links to have on hand while we're doing the open enrollment process. One is I do want to share my link for my scheduling. If you want to schedule a one-on-one time with me to talk about um, the benefits, to talk about specific circumstances for your organization or questions that you have, I definitely welcome you scheduling time with me. Um, we have our website, usworker.coop/worker benefits. Um, which has links to all of these other things. Our knowledge base, which is like an FAQ, our resource library, which is a website with all the different files and flyers that will be updated with our 2025 info sheets very soon. Um, yeah. We also will have another an office hours time in November that will I'll probably be presenting a little bit more about like the actual enrollment process since we didn't get to do a lot of that today, but it will also be a time for people to ask questions um, and to learn just along with other people. You know, even if you don't have a specific question, I definitely recommend coming out to hear what other people's questions are and just like learn along. Maybe it'll spark something for you. Um, and so that is on November 19th from 4 to 6 p.m. Eastern. The follow-up to this webinar, that's going to be an email you don't want to miss. It's going to have a lot of information in it, but including a sign-up link for that webinar. Yeah, and so I wanted to pause there and see if anyone had questions about this, and I also wanted to like open some space just for discussion about like benefits in general, and I have some prompts for that, but we'll start with just like the logistical questions that folks might have now. Okay, cool. So I am curious, like this is sort of my like moment where I want to gather some feedback, and also just hear what else is happening in your organizations. Um, these are like three very broad questions, but I would love to just hear anybody's answer to any of them. What kind of support, resources, or connections would help your workplace utilize our program? What kinds of support, resources, and connections to other people would help your co-op take care of its members' health? And what other benefits, aside from dental and vision, is your workplace currently offering its members, and how is that going? Um, and yeah, I'd just love to hear if any of these questions are speaking to you, what your thoughts are. Oh, I'm seeing from Kara, we offer life insurance. Is that something you've considered adding? It is something we've considered adding, and we are actually looking at ways to offer life insurance as well as an EAP, which is an employee assistance program, in the future, probably for 2026. Um, so we're actually working pretty hard on trying to bring something like that together. Um, and so yeah, good to know that that's something you all are offering, Kara. Um, and Hera. Okay, I'm seeing from Alyssa, offer medical, life, disability, and retirement. Looking into an EAP. An EAP or an employee assistance program basically offers people access to like a hotline kind of thing for people to access like mental health support, or even other types of support like financial support, or like financial troubleshooting, not like cash, but support for workers who are in tough situations of a variety of types. I'm seeing Henny offers a health stipend aside from sick and vacation time and are wanting to have a better package for health insurance or health benefits. So hoping that can start in 2025. That's awesome, Henny. Um, I'm seeing from Kara that gym memberships is something members have asked about. Is that something that would come through an EAP? I don't think so. That hasn't been something I've seen offered, but a good idea to consider. I'll go to Shayo and then come back to the chat.
Yeah, hi everyone. I know that at least for Wholehearted, we've been also talking about like holistic um supplementation for folks. I think in our co-op, we have folks that are using like herbals as preventatives to increase their health. Um, like massages, being able to go in for like healings, things that are going to I guess it would be. We were thinking preemptive care, but we're not quite sure where that would land. And I guess
Mhm.
that's kind of like if other folks have those in place, what does that look like? And I just, I thought it was kind of funny because our name is like holistic bookkeeping, but like also trying to keep that as well as like as worker owners, like that outlook on the way we interact with the world and like income. So that was our thing.
Yeah, I think the kinds of benefits, like sometimes it's going to be so different for each workplace. And I think that's great to have benefits that are like responding to the specific needs and wants of like who your people actually are. Um, I think like some of those things you could access through an FSA, which is a flexible spending account, or HRA, which is a health reimbursement account. They do effectively the same thing. Um, but not like definitely not all of those things, like, but some of them, like some massage, acupuncture, um, could be covered. And that's just a benefit where like it's still your money that you're paying, but it's not taxed. So it like reduces your tax burden a little bit. Uh, yeah, I'm seeing from Nolan that they offer PTO, short and long-term disability, life, and AD&D, which is accidental death and dismemberment, an EAP, a simple IRA with a 3% match, and a Costco membership. That's amazing, Nolan. Um, would love to offer pet insurance. That's definitely becoming more of a workplace benefit too, pet insurance. That's really cool to see. Who muted me? Anyway, uh, yeah, that's really great. I'm seeing from Alyssa, mental health is a huge topic with the Dowie team. Always looking for alternative options for mental health support. Um, yeah, I think an EAP can be a really good option for like sort of supplementing mental health support. Um, and yeah, there's also a lot of like a lot more telehealth options out there for mental health support than there used to be. Um, I think it's like some of the quality of it might be mixed, but some of it's really, really good. Um, I see Eden is saying that they have health advocate as part of their benefit package through the PEO, JustWorks. People have found that that's helpful. It's a number you can call if you have questions about your coverage or need help with a claim. Eden, I'm wondering if you could say a little bit about what the PEO is and how it works for seed comments.
Sure. They are a payroll and benefits provider, but it's set up as a co-employment situation. We used to kind of do our own payroll, and as we grew, it just became unmanageable. And now that we're a national organization that's basically, almost completely remote, we needed access to health insurance benefits for people all over the country. So we joined JustWorks to kind of facilitate that. So they have health plans that they provide through Aetna, and they also, run our payroll, pay our taxes, do the quarterly tax reporting, and they have a whole like suite of benefits that they offer as part of the membership. It's not cheap. We pay, I think, $89 per month per full-time employee and 49 for part-time. But it does make a lot of things possible that we wouldn't be able to do otherwise. So it's probably worth it.
Well, thanks, Eden. Yeah, I know that a PEO is something that a variety of our members use or have used, and it can be a really useful tool. Well, thank you all so much for all these ideas and notes about what you're offering. Um, Nolan, I'm curious if you could, if you're able to like come off mute and like say a little bit about like how you all decided to offer sort of all these benefits and like what how you approach it in terms of like budget or like discussions about it.
Yeah. Let me know if anyone has any issues hearing me. I know I cut out during my introduction. Well, it started with procuring like vision and dental through you guys, USFWC. We know that like health insurance is a huge benefit that we want to be able to offer that we currently can't afford to offer. We've looked at our own, like, we've gotten quotes for just our workplace. And like you guys know, it's incredibly expensive. So we really jumped at the opportunity to be able to offer vision and dental. And I forget exactly um, how my GM, Rachel, originally where she got her quotes and from who. I think it might be for our accidental death and dismemberment, life, short term and long term, and our EAP. That's all through Unum insurance. And I believe we have a financial advisor who runs our simple IRA. And I believe it was her who maybe helped us get in touch with Unum or like offered us a couple of those options. Um, Honestly, I think like, for example, our simple IRA is simply through connections. The person who administers our simple IRA used to work for us back in the day. And so she is actually now like, she offers free financial planning services to all people on staff in addition to like administering the simple IRA. Tonight, she's actually doing an info session for all of our staff members who want to sign up, um, kind of about like what that looks like for us. And I believe she's the one who got Rachel in touch with Unum, who then offers the rest of our insurance benefits. And the Costco membership, we just have like a workplace membership. And basically, I kind of go to Costco and I fib and I say, hey, all of our staff need to have Costco cards. So it does affect like the amount in which we pay. The more people we put on the account, the more we have to pay in our membership fee. But they've never told us no. So everybody kind of gets a free Costco membership and we just kind of eat the cost on that. But as far as I know, it's never caused an issue. So
Well, thank you so much for sharing that. I love that. And thanks for coming, Shia. Um, yeah, I think those like sort of informal networks can be really, really valuable, especially like if your work is in a local place, like local, it's just a different landscape when you're dealing with like workers who are distributed across the country. But when you have like a tight-knit workplace in one spot, I think there's a lot that can be done with like local information sharing. And would definitely like just tout that as a great resource. Uh, cool. All right. Well, it's about 4:30, so I think we can wrap up, though I'm happy to stick around after if people have other questions. Um, thank you so much for being here. And thanks everybody for your great questions. You'll be getting more information from me about um, yeah, about 2025 rates and details, much more to come. And yeah, I think there's a lot. I'm gonna end it just on this note of I think there is a lot that we can do um, in sort of our local micro ecosystems, and I'm always thinking about ways to help support that from my role as the Federation uh, worker benefits manager. Um, so yeah, Nolan, I'll connect you with folks if there are folks out there. And yeah, thank you all for being here. It was great to have so many folks on the call.